I'm Dr. Bret Schroeder, the medical director at dietdoctor.com, and this is an important topic that I've been spending a lot of time on with a podcast, and we have some guides at Diet Doctor about the role of ketogenic diets for mental illness. And I mean, let's face it, mental illness it's not one thing, it's many different things, but the incidence seems to be rising, and the treatment options are less than optimal, let's just say, because they don't work all the time and they come with significant side effects. So if a dietary intervention that has otherwise beneficial effects from metabolic health and energy levels could also help, that's like the holy grail. That's the treatment we really need to be promoting. And now there's a building level of evidence in favor of ketogenic diets. Now, it's very early, and as they say in this paper I'm going to review, they use the word it's in its infancy, and I completely agree. But with the focus that we're putting on it, and with the Bazooki Brain Research Group, and doctors like Dr. Chris Palmer and Dr. Sathi at Stanford, and the research studies, Dr. Ian Campbell, the research that's happening, this field is going to take off. But let's talk about this one study. It's called The Ketogenic Diet of Refractory Mental Illness, a retrospective analysis of 31 inpatients, and it was published in the Frontiers of Psychiatry. Now, this was really interesting because this was one physician's practice, Dr. Denon in France. And co-authors on this paper are very well known, Dr. Eric Westman, Dr. Laura Saslow, and Dr. Georgia Eid, all very well known in the low-carbon keto community. But what Dr. Denon did was he has a practice in France, a psychiatry practice, and he was able to study this intervention, a ketogenic diet intervention, on 31 patients who were inpatients. And this is what's important. They were in the hospital, in the mental health hospital, so they could control the food. And they were given the option of the standard diet or a ketogenic diet along with standard of care. So that the care didn't change at all except for the dietary intervention. Now, they didn't compare it to the control group, right? It wasn't randomized. They didn't follow the control group. They didn't say what the differences were. So this was a retrospective analysis. So not the highest level of analysis. So by no means are they even portraying this as sort of like the end-all be-all proof, quote unquote, but certainly a proof of concept. Certainly something to suggest this deserves more attention. So these patients had a combination of diagnoses. Either had a diagnosis of bipolar disorder, schizoaffective disorder, or major depression. And they were in the hospital, and they were given a diet that was protein about 15 to 20%, fat 75 to 80%, with less than 20 total grams of carbohydrates. The main outcome was a change in symptom score, and they used a couple of different symptom questionnaires to quantify the symptoms that people were having from their mental health conditions. Without going into the specifics, jumping to the end though, there was a significant reduction in all of the symptoms in 100% of the patients. Now, there were 3 who dropped out, 3 who couldn't comply. So 3 out of 31, pretty good start. But there was a 100% improvement in their symptoms. And the symptom improvement averaged between like 60 and 75%, pretty significant decrease in symptom scores. And on top of that, 64% of the patients were able to reduce their medication. So I see this as very similar to the Virta Health studies, where people were improving their A1Cs while reducing medications, which is sort of like the opposite of what most doctors think can happen. They think if you're going to reduce your medications, your blood sugar control is going to get worse. Virta showed the opposite. In this trial, Dr. Denon, looking retrospectively at his data, showed that even with reducing the medication, people were improving their symptoms of their mental health condition. So that is very powerful because these medications have side effects. They alter brain chemistry. That's what they're supposed to do. That's how they can help with the mental health symptoms, but they also can cause people to be drowsy and fatigued and have trouble sleeping and not be as mentally clear. So reducing the medications while improving mental health symptoms is a huge win-win. And this wasn't the primary outcome, but interesting, they also reduced their weight and their blood pressure, their hemoglobin A1C, their triglycerides, the other things we expect to see that benefit from a ketogenic diet. Now, he also followed up once they were discharged, and about half, 46%, continued on with the ketogenic diet. So not ideal that only half continued. When you get out into the quote-unquote real world, the meals aren't provided for you. It becomes more logistically difficult. So I'd like to see how that group would do with some more intensive intervention to keep them on a ketogenic diet whether it's an app-based or coach-based or whatever the case may be. I think that would be really interesting. But the bottom line is, look, it's just more evidence that a ketogenic diet has a role in treating severe mental health conditions, whether it's bipolar disorder, severe depression, or psychoaffective disorder, that altering the brain chemistry, giving the brain ketones, mechanistically seems to work. Does it work better than other interventions? Well, we need randomized controlled trials to prove that, and those are being done. We had our podcast with Dr. Ian Campbell. He's doing that. We had a podcast with Dr. Shivani Sethi. She's doing that. There are a number of different groups that are doing randomized controlled trial, largely funded by the Bazooki Group and being promoted by the Bazooki Group, who is doing fantastic things to help raise the awareness of mental health conditions and the role of lifestyle interventions, including a ketogenic diet. Now, as you may have heard in our most recent, or as a recent podcast with Matt Bazooki and Dr. Ian Campbell and Dr. Chris Palmer, it's not like ketogenic diet is the end all be all, right? It's part of lifestyle therapy, which includes sleep, very important, which includes no drugs and alcohol, which includes exercise, right? So it's a multi-pronged approach, but a ketogenic diet can play a very important role in that. And the mechanisms make sense because there is a huge overlap between the mechanisms of seizure disorders and mental health conditions. And we know ketogenic diets work for seizure disorders. And now we're learning more and more that they also likely work very well for these mental health conditions. So again, one more piece of the puzzle, one more study to just draw attention to say, hey, we should be looking at this. We should be talking about this more. We should be promoting this more, and we should be studying this more. So I'm pretty optimistic about the future of ketogenic diets for as one treatment of a multimodality treatment for mental health conditions, because the evidence keeps growing. So I hope this was helpful. If it was, please click the thumbs up and subscribe, and we'll see you here next time on Diet Doctor News on YouTube. Take care, everybody.